healthcare deserts for parts of the state, and what can be done federally to keep those hospitals open and providing necessary care to community members?
Yeah, I appreciate that question. It's a very, very serious problem, and unfortunately, this, like so much of else of what's going on in our country right now, is a problem that we inherited from the last administration. If you look at the number of rural hospital closures that were happening in 2022 and 2023 and 2024, it was really accelerating. And it's one of the reasons why it's not a provision that's talked about as much, but if you look in the big, beautiful bill, the Working Families Tax Cut, however you're calling it, in that legislation, there is a multi-billion-dollar rural hospital fund to try to help these rural hospitals persevere in tough times, stay open, provide essential services, and get them to a place where they're on firmer financial footing. Nothing like that, I don't believe, Derek, had ever existed in the federal government before, but we said, look, we cannot let these rural hospitals just disappear, so we've created this fund to try to, support the ones that can stay open and try to slow the closures for the ones that are going to have to close. We think that we're starting to see some good evidence from those. It takes a little bit of time for that tens of billions of dollars to work its way through the system, but that's the number one thing. And then the number two thing is the Trump administration did a number of things in the first term, and we're trying to do this in the second term to give patients more choice. Because what we often do in our healthcare system, like for example, if you're a veteran, under the Biden administration, we would force veterans to drive an hour and a half away to a big city hospital when they could maybe go to a telehealth appointment in their own home, or maybe drive 15 minutes down the road to the local doctor. So we've tried to empower people to have more choice, because if they have more choice, they're going to be able to stay in their communities, which means more money going to those rural healthcare organizations, and that's the way that we save rural healthcare too. It's a tough problem. I'm not going to pretend it's easy, but we are working as hard as we can to make sure that the people in our rural communities still have access to great healthcare. Thank you.
Hoff with the Midwest Farm Report Radio Network, talking to farmers across the state of Wisconsin. My question for you today is, commodity markets have not been friendly to Wisconsin farmers. I'm talking corn,
Sure.
soybeans, and dairy. What is the administration doing to bolster trade, increase export markets, and those relationships to bring market prices back up?
Yeah, so the good news on that is that our great Secretary of Agriculture, Brooke, has been on this from the very beginning. I think it was maybe the first cabinet meeting where Brooke comes up to me and says, JD, the farmers have inherited a mess, and we've got to do everything that we can to ensure that they can stay afloat during this very tough time. So one of the things that we're doing is making sure that wherever commodity prices are, that our farmers can do their job, they can provide their food, and if they fall on tough times, there's a little bit of a support mechanism there. Now you might say, why do we do that? But the answer is actually very simple. If we don't have American sovereignty in our food supply, we don't have sovereignty at all. If you cannot depend on your neighbors to provide your food, if the food that you're relying on comes from another country, say goodbye to sovereignty, because that country is the one that controls you. The country that controls the food is the country that will ultimately control the entire world. So we've made very strong efforts, and we're going to keep on working at this with our farmers to ensure that whatever commodity prices are, they're able to stay afloat, they're able to grow their products. We know that they're struggling, and we're trying hard to fix that. The other thing the president has done is, for a very long time, China, one of the biggest buyers of soybeans, they would take advantage of American markets, but they would not take the product of Wisconsin farmers, whether it's corn or soybean or whatever it is, they would not offload that product into their country. Now that was a fundamental unfairness, and that's why the president is fighting back and making sure that we have fair trade practices. If you don't have countries honoring the United States of America, our great farmers and our great manufacturers, if you have countries that are able to come in and undercut the wages of our workers, but we're not able to export their product, ladies and gentlemen, that is not trade, that is international fraud, and that's what's been happening far too long all over the world. The President of the United States is stopping it. We're going to keep on stopping it to the benefit not just of Wisconsin farmers, but Wisconsin manufacturers too. So let's say we'll take two more questions here. Sir.
Thank you, Mr. Vice President. Dylan Eckhart, 9 News, out of Wausau, WAOW. Nationally, there has been bipartisan legislation introduced sticking with agriculture. For example, the Domestic Organic Investment Act, which would make a USDA's development grant permanent, allowing for grants for farmers and businesses. How will the administration continue to work with local farmers and businesses in Wisconsin, especially central Wisconsin, to expand on some of those ideas and introduce legislation?
Well, you heard a little bit of my answer in the last question, but you're right that there's a lot of legislation that's working through the Congress, and as broken as Congress is as an institution sometimes, there are still some good pieces of bipartisan legislation that happen. Luckily, I think agriculture is one of those areas where you still have some good bipartisan pieces of legislation. You ask how we're going to work with local farmers, especially in central Wisconsin, and the answer is just to listen. You know, we've got a great legislative team at the White House, but we've also got a lot of great allies like Derek Van Orden in Congress. And what these guys are doing is they're coming to us with ideas. And they're saying, look, we heard from our constituents, this is something we've got to do. You know, whatever the product is, you know, sometimes they're most concerned about commodity prices. They're worried that the soybeans and the corn, it's way too low. Sometimes they're worried, of course, about inputs. They're worried about fertilizer. They're worried about the cost of fuel. So what we just try to do is work with our allies in Congress, and frankly, we'll work with anybody in Congress who has good ideas about how to help our farmers. We're going to have some good legislation on this front over the next year. It's just a question of getting it over the hill, getting it to the president's signature, or to the president's desk, I should say, for his signature. Thank you. One more question.
Thank you, Vice President. Derek Schritz, Newswatch 12, and Ryan Lander. Wanted to ask about the healthcare worker shortages in several hospitals. Hospitals in Wisconsin are experiencing or are worried about the aging shift, aging demographic shift, and I'm wondering what the administration will do to bolster the healthcare workforce in the coming years.
Yeah, a couple things that we see is one, you know, we're encouraging hospitals and all healthcare providers, and we're seeing some evidence of this, to use technology to your advantage, right? So if you've got, let's say, a guy who needs to see a doctor, but he can see that doctor from the comfort of his own home, doing a telehealth appointment, you know, sometimes you got to go into the doctor. Sometimes you can actually do that by just talking to the doctor at home. That we're trying to encourage because that puts less stress on some of the healthcare workers. If you can just see somebody quickly, it's in and out, you don't have to deal with all the paperwork of coming in for a doctor's visit. That's one of the ways that you relieve that stress and shortage that we see in our healthcare workforce. The other thing is that we're investing a lot to try to make sure that we meet the doctor, the nurse, the physician assistant shortage. The basic problem that we had in our country is that for a long time,